When you entered, you were like just finishing medical school, and you knew you were entering during a pandemic because we found out we were coming to Emanate Health and there was a pandemic going on. And you worried about like, am I going to be safe? Like, am I going to see COVID patients? Like, you question it because you didn't know. And sure enough, yes, you will be seeing COVID patients. Like, that is part of your training. Gosh, I remember this moment so vividly when I went into my first COVID positive patient's room. No vaccines at the time, still like, what is COVID other than this novel virus? And then I was about to open the door to the patient's room, you know, gowned and everything. And then I just like stopped and was like, oh, like you're entering a patient's room. So like I was like smashing my N95 into my face, making sure it was very snug. And it was a reality check because I was so focused on the patient, right, going in, talking to them. And then I realized like, oh, I need to like make sure I'm protected too. One of the biggest things for me was that I noticed like I was scared, but also like the patient was scared, and trying to find that like balance of like, how do I protect myself, but also like give good patient care and like talk to them and like hear them out and answer all their questions. I think that our program did like such a good job with providing us with PPE. Like, we never once felt like we weren't protected in that sense. So that felt like really nice and like reassuring. The patients who are like on that very borderline of like doing okay but kind of getting worse, you start to catch that because they kind of start to like look the same at some of the days when you know that they're worsening, unfortunately. I had a gut feeling like, oh no, like this patient's doing worse. And like, you hate to think that, right? And you're trying to scramble, trying to think of what you can do to help them. I 100% remember when visitation was allowed at the time for really critical ill patients, and we had a family member come in, and they were bedside when the patient started to code, so we had to have them leave the room. And I was the doctor talking to the son about his mother. And I mean, his like crying and screaming, I can still hear till this day, like on the floor in the hospital on the 3rd floor. Like, I vividly remember it. And you're just like, how do I help this person like any further? You know, like, how can I be there for this family member? Like, as a doctor, knowing that this patient, like, they're critically ill. They're so critically ill. They've coded like 3 times already. And like, knowing that you had to tell someone like their mother who was visiting from Mexico, they hardly get any time with her, is like passing away when she finally came to California to visit you guys. Like, it's unexplainable. The pandemic has changed my patient-doctor relationship by really trying to incorporate seeing them as a human being and not just as a patient. You know, the medicine part, it can be easy, right? Some of it is repetition, some of it is just how good your clinical acumen is. Any doctor can apply that, but not every doctor can empathize with their patients and remember, like, they're not just a patient. Like, this is someone's mom, this is someone's dad, their brother, like their kid, whoever it may be, and like putting yourself in their shoes. At the end of the day, like, I am a family medicine physician. Like, I take the word family very seriously when it comes to that. I recently had a patient who delivered a baby and had complications after, and she didn't get to see her baby, and she didn't get to see her husband or any of her other kids. And I looked at my piece of paper when I was rounding on her, and we have length of stay on our paper, and it was 12 days. And I looked at her, and we both started to cry because I was like, do you want to see your husband? Like, who do you want to see? Like, your baby? Like, you haven't seen anybody. Like, that's wild to me that you deliver a kid and then you get so sick after that you can't even see your child. And so we moved her hospital bed into a different room that had a window on it that faced the outside at Queen. And she was able to see her family like through the window. And that was that. That took me 5 minutes to organize, right? And like 5 minutes out of your day is nothing. and it made her whole stay, right? Finally being able to see her family. We have to remember these things as physicians and not just do the medicine part of things, but also do the humanity part of things. I enjoy so many things about being a family medicine resident. Specifically at Emanate Health, everyone is super supportive, and that's what really drew me here. I think that being a resident, you work in a high-stress environment. It's rigorous training. You've already sacrificed so much of your life as a medical student, and now you're sacrificing more of your life as a resident. To finish residency and have this in your back pocket, in your toolkit, is super, super important, because after this, you don't have people watching over you after residency. It's really you as an attending. And so having this solid foundation 100% will make me a better doctor, and it already has made me a better person, really being able to empathize with this patient population.